Okay, so we have about an hour to squeeze in as much information and answer as many questions as we can. So let's begin with our county executive, Mr. Stuart Pittman.
Thank you, Roz. So here we are, week 4, COVID-19 virtual town hall number 4. I want to start by honoring a family in our county that is grieving deeply. On Thursday afternoon, Maeve McKean and her 8-year-old son Gideon boarded a canoe to retrieve a ball. Our fire department's mobilization has since turned from rescue to recovery. I want people to know who Maeve was and what she did. Maeve was the executive director of the Georgetown University Global Health Initiative. She focused her life's work, where we are focused today, on the one thing that is important to every human being on this planet, the one thing that has the potential to bring us together, our health. In the words of Maeve's mother, Anne Arundel County resident and former Lieutenant Governor Kathleen Kennedy Townsend, our Maeve dedicated her life to society's most vulnerable. She said that her grandson Gideon was a loving big brother who excelled at sports, riddles, math, and chess. My heart is crushed, Kathleen said, yet we shall try to summon the grace of God and what strength we have to honor the hope, energy, and passion that Maeve and Gideon set forth into our world. Amen. Today's message from me will be a little different and shorter. I am not going to review, as I did last week and the week before that, all of the creative work that our county departments are doing to serve residents. You can sort through all of that information yourself by going to aacounty.org and clicking on the coronavirus link. I do, however, want to thank all employees of the county. They are truly dedicated public servants, and I will continue to thank them every chance that I get. On that note, I want to give a special thanks to the people you're about to hear from. Our County Health Officer, Dr. Nilesh Kelley, is the commander in this battle. His work and the work of the health department team will save a lot of lives. Our school superintendent is overseeing an extraordinary effort to deliver the education that our kids need without bringing them to school. I can think of nobody better suited than Dr. George Olato to take on that challenge, but he'll be the first to tell you that it's our teachers who will be the real heroes, as they always are. I'm also thrilled to have Christine Feldman here to talk about how our libraries are continuing to educate and engage our residents of all ages and to boost the morale countywide. So while I'm thanking people, I especially want to thank everybody who works in healthcare, particularly those who work in our hospitals. You are the soldiers in this battle, and we will forever be indebted to you for your service. We must protect you as you protect us. And finally, I want to thank community leaders. Last week, I was asked at this town hall what people could do to help their neighbors. I went back to our community engagement and constituent service staff, we call them CECS, and asked them the same question. The next day, they launched a survey asking community leaders in the county what they are doing. The response was overwhelming. Some told stories of volunteer networks, and others asked for ideas that they could do more of what they could do. We'll be putting out best practices and offering tools to help you engage, but it's up to you. When we say that Anne Arundel County is the best place for all, it's more of a challenge than a fact. I challenge every one of you to make your community or your neighborhood the best place for all. And please let our CECS staff know what you're doing by contacting them at cecs@aacounty.org. On that note, I've noticed some very good things happening. It seems to me that people are being a little kinder to each other lately. Have you gone outside and walked around the block just to get out? Have you talked to a neighbor down the street for the very first time? Have you felt the urge to ask someone you really don't like how they're doing? Have you been thinking about the 9,000 people in our county who filed for unemployment last week. That's the kind of thing I'm seeing all over this county. I did a shift here at the call center this week at the Office of Emergency Management in Glen Burnie. The number here is 410-222-0600. Please call that number, whether you need help or you want to help. But everyone I spoke to was very understanding and very appreciative of anything that we could do for them. I also met with county employees this week at a waste management facility, at a park, at our new donation management center. All of their jobs have changed in some way, and all of them are taking a risk by doing their essential jobs. But none complained. They all showed that strength that comes when people have a purpose. I spoke on Monday by teleconference with the leaders of our hospitals. They're planning a 60% expansion of bed capacity and training their staffs to manage a patient surge beyond what any have ever seen. But they were fearlessly and methodically preparing their teams. Some of us are frustrated and also afraid. How could the federal government have failed so miserably in its obligation to prepare for a pandemic like this when so many experts were demanding action? Why can't I get tested? How will I stay in my house when the bank's forbearance ends in 60 to 90 days and I've lost my income? How will I be able to reopen my business at the end of all of this? How can I take care of my kids or my parents if I get sick? These are very good questions for which there are no good answers. But they're not new questions. They're the same questions that millions of American families have been asking themselves in what most of us experienced as good economic times. What has changed with the coronavirus is that many more people are in trouble. What's changed is that nobody can ignore the suffering. The Community Foundation of Anne Arundel County publishes a report called Poverty Amidst Plenty. It's about poverty in our county that most people didn't see and that government usually ignored. What we're looking at now is more like poverty amidst everyone. Reverend Steve Tillett of Broadneck-Asbury United Methodist Church said last night on the Feed Anne Arundel virtual benefit concert that, unlike before, now we are all in this together. I think he's right. That's why Congress was able to unanimously pass the Coronavirus Aid, Relief, and Economic Security, the CARES Act, that expands unemployment benefits and puts money where it's needed to rebuild our economy after this crisis from the bottom up. That's why the Republican governor and the Democratic General Assembly in this state were able to draft and pass legislation to help working families and small businesses in record time before early adjournment. That's why I was able to call Councilman Nathan Volke, a vocal opponent of my budget last year, and seek his advice a few days ago on how best to build a balanced county budget for FY21 in the face of drastically lower revenue projections. So my message today is that this truly is our moment to be better than we've ever been, to make peace with our adversaries, to give thanks for the grace that connects us, and to build community everywhere, even if that means doing things that just don't feel normal. And I will now make a very public step into the not so normal. You heard yesterday that the CDC is now encouraging us to cover our faces when we're in public. My mother-in-law, like so many other wise and caring people around the world, was a step ahead of the government. She found some old quilting material, sat down at her sewing machine, and created this. Thank you, Sue. I hope you'll participate in this new fashion trend. This is all a part of acting as though you are a carrier of this virus. Stay at home, wash your hands, get plenty of sleep, eat well, and exercise. We need you to be healthy and resilient. I will now sit down and turn over the podium to our County Health Officer, Dr. Nilesh Kelley.
Good morning. It's good to be with you here today, as the county executive mentioned, for the fourth Saturday now. I'm going to start off by talking about what I always talk about, which is the importance of each of us and our actions and how they build up to help prevent the rapid spread of COVID-19. We talk about social distancing. It continues to be important. Making sure that you're staying 6 feet from others, avoiding unnecessary travel out of the house or where you are staying, and making sure that you're using good infection control. So making sure that you wash your hands frequently, particularly if you're out, wiping down, disinfecting frequently touched surfaces, using hand sanitizer if you don't have access to hand washing, avoiding touching your face. And to that, we're going to add another item, which is masks. I have my mask here. I wore it into the building today. I'm not wearing it now because I can't speak through it and talk to you through this microphone because it's a homemade mask. Unlike the county executive, I have no sewing skills, nor anybody do I know that has sewing skills. So I did this in 2 minutes, and in about 10 minutes when the rest of our speakers are done, I will demonstrate to you how you can make your own mask. Now, the question we often get is, why is there so much confusion? Why are things changing? Why are people saying one thing and then another? I think in this moment, which is unprecedented in so many ways, you out there are learning scientific knowledge at the same pace that we in public health are learning it. That's challenging. Usually we have time to figure out what's going on, to understand the science, to understand the effects of the changes that we're recommending, but we don't have that time. And that's why what you see and what we sense too is some of that confusion. So the question, why is the CDC recommending those masks? A couple of reasons. One, we've seen that in countries where masks are being used much more by the public, they're doing better. Admittedly, there are other reasons for why that may be the case, but as I mentioned, we don't necessarily have the time to be perfect on this. The second is that we're learning that people who don't have symptoms, it looks like they can spread the virus just as much as those with symptoms. And so that's the real reason that we're recommending mask usage when people go out in public. By wearing the mask, even if you have it, you don't know it, this cuts down on your ability to spread it. And at the same time, if you don't have it, cuts down on your ability to get the virus. It's not easy. It's going to be uncomfortable. It feels weird. It felt weird to get out of my car, put on a mask, and walk into a building. But that's where we are. We're doing a lot of things that don't feel quite right. One of the things that also we talk a lot about is testing. And I'm happy to report that this week in Anne Arundel, we did over 175 tests for the public, Monday through Friday at 2 different sites. One is at the Glen Burnie Vehicle Emission Inspection location, and the other was at the Anne Arundel County Department of Health on Harry Truman. And we're going to be continuing that because it's really critical both for those who are sick to be able to know what's going on with them, and also for us in public health to be able to understand how far this is spread and which communities are getting testing and which aren't. And that's one of the things that we're looking at really closely is how do we make sure that everybody has access to testing? Those without transportation, those who are historically underserved, that is a key part of what we are doing. I also want to just take this moment to acknowledge the tremendous amount of work that's being done in the hospitals, but also throughout the healthcare community. I have frequent calls with primary care providers, behavioral health providers, the hospitals, nursing homes, and everybody is ramping up in a way that I have never seen before. In the 20 years that I've been doing this, I've never seen us move this fast, this collaboratively, to cut through this much confusion and frankly bureaucracy to get things done. And so I want to thank everybody out there in all of healthcare who are every day not only figuring out how to shift the world under their feet, but who are also taking that risk and who are stepping into the breach and working in situations where they know they're going to be exposed. And on that note, I want to end by thanking those at the health department. I know quite intimately how many hours everybody in that health department is putting in. We have created a whole new organization, one that didn't exist 3 weeks ago, where people are doing something that they never thought they would do. We're having our school health nurses providing infection control and contact tracing. We have our environmental health folks doing registration for drive-through testing, and on and on. And so I want to thank them publicly for the work that they're doing. So thank you. And at this time, I'm going to turn it over to Dr. Arlato.
Thank you and good morning. Thank you so much for the invitation. Certainly I need to begin by thanking our county executive, Mr. Pittman, and your team for your leadership during these difficult times, and as well thanking Kelley and his amazing team in our Department of Health. Both you and your teams have been incredibly collaborative with the school system, with our folks, and we're very much appreciative of that. So thank you for your continued leadership. It's been a fantastic partnership. Let me begin with everybody out there that we really miss our students. I've been trying to get out to our meal sites several times a week, not only to assist our food nutrition service staff, but it's more important for me, I guess, that I'm out there and I'm seeing some of our students and our families. And so that's been a joy to go out and see them, know how much we miss our students, know how much we miss you, and we can't wait until schools reopen, and we hope that it opens soon. So with regard to our school system, ACPS, we have focused on 3 key areas that I've reported to you during in a previous town hall. The first is to ensure the continuity of operations of our school system, and that continues to go well. We've been able to maintain our business operations, including payroll, contracting, purchasing, and recruiting in our HR department, as well as maintaining our technology infrastructure, with most of our personnel working remotely from home. And so I want to thank our teams for continuing to work so hard in these endeavors. Second, we've been developing and implementing a continuity of learning plan for our 85,000 students. And thirdly, we have been focusing on feeding our students as we realistically can reach as many as possible. So with that, let me talk about meals first. We began our meal distribution at 57 sites, serving 3 meals a day on the first day of our school closure. In 15 days, the meal distribution, we have served 120,000 children, and we've served more than 359,000 meals. And we are now at 60 sites across the county. Although we cannot, we are unable to provide meals and set up in every neighborhood because of staffing and logistics, and there is an incredible and growing need. I'm very proud of the food nutrition service team. They've been working tirelessly for the past 3 weeks, and they continue to do that as long as we are able. I've been at many of the sites, as I said earlier, over the last 3 weeks, and our students and families are very appreciative of our efforts and have shared their thanks with our meal site teams. Thank you for those words of encouragement and appreciation. Our staff very much appreciate you, and they very much appreciate your words of support. Please keep those coming. On the first day of meals, on our first day of school closures, we served 3,385 children. Yesterday, we served 10,730 students. We've had a record high. We had one day this past week on Wednesday, we served 11,600 students. I just think that's incredible, but it does show the growing need, and we want to hopefully we'll be able to keep up with that need. With regard to education, we've been in touch with our families through our website, our e-learning website. Schools, of course, have been closed since March 16th, and they will remain closed to at least through April or up to April 27th. Our state superintendent of schools is working closely with our governor, and they will make the decision as to whether we will continue this closure or reopen schools. That will be a decision made at the state level. So we are planning for both reopening as well as extended closure. I'm in constant contact with the other superintendents across the state. There are 24 of us. And we meet regularly 3 times a week via conference call or video call together, along with the Maryland State Department of Education leadership, including Dr. Karen Salmon, our state superintendent. And we are working together to develop ways to engage our students during this crisis, and we work on a myriad of questions, concerns, and in some cases, state regulations that don't support our current emergency circumstances. Some changes will need to be made at the state level in order for us to continue this closure process. Our academics team has been putting enrichment lessons online on our e-learning website, also on AACPS TV, and as well as printed format for the last couple of weeks to engage students. Our official e-learning initiative is now up and running. Teachers spent this past week participating in online professional development and setting up their virtual classrooms using Google Classroom. Many teachers began reaching out to the students this past week, and all teachers will be in contact with the students beginning on Monday using their Google Classroom, Google Meets, or Google Voice. The learning schedule we have developed and published up on our website is focused on creating both structures and flexibility for students, families, and teachers. Both the structure is important, as is the flexibility, as we are all adjusting to this new normal. Elementary teachers will establish learning time in the morning and office hours in the afternoon, and they'll be in contact with their students about that schedule. Likewise, secondary teachers, that's middle school and high school teachers, will establish office hours in the morning opposite the elementary and learning time in the afternoon, and they too will be in touch with their students and families to give you those schedules. We are distributing Chromebooks to families, to students in need. We know that we have both we have issues with students that don't have devices at home nor internet access. So we have a number of Chromebooks, as you know, throughout our school buildings that our students are used to using on a daily basis. Now that we're closed, we are re-imaging those. We have to take those out of the carts that the students know well, and we have to re-image them so that when they are turned on at home or in another a remote location away from the school, they'll be able to accept a Wi-Fi signal. So we are re-imaging those Chromebooks. We are set to start distributing the first 2,000 of those on Tuesday of this week. We sent out a survey 2 weeks ago, and we got about 25,000 responses to help us better understand the need for both devices and internet access in the county. We have about 4,000 requests at this time, and we'll begin filling those requests in a tiered system this week. Focusing first on those students that have no devices at home and seniors that need a device, because we know how important it is for them to finish their work to get ready for graduation. So families will be receiving phone calls going out today, Saturday, as well as Monday, to let them know where to pick up a Chromebook. We will be distributing Chromebooks from 11 high schools and 1 middle school beginning on Tuesday. We will do that. We hope to have another 2,000 ready for Wednesday. And then if there are additional needs beyond our spring Easter break, we will continue that into the next week to distribute Chromebooks as the need is there. We also recognize, as I said, that families don't have internet access. This one is a little trickier for us in that we are not able to provide direct internet access for our students at home. So several things that we've done is we've been working with Comcast. Comcast has had a very inexpensive Internet Essentials program that they've had out there for a number of years that we've advertised for our students. They are now offering that for free for 60 days. We've put that out there and on our e-learning website, and we hope that families in need will take advantage of that. I understand that Comcast has opened up their Wi-Fi hotspots at businesses and in public areas, so that you can go into, say, a grocery store parking lot possibly and park your car and access in Wi-Fi signal, where students then could open up their Chromebooks and download a lesson or upload some work. And so likewise, we have taken We've opened up our Wi-Fi signals at all of our schools, and we're trying to enhance those signals so that you should be able to now the public can access from 7 o'clock to 5 o'clock our school Wi-Fi at all of our schools by pulling close to the building or into the parking lot. Different buildings will have different better reception areas than others. Some will have stronger signals, but we're trying to enhance that signal, and we've opened up our Wi-Fi signals at all of our schools for our students to access. While we continue to meet the challenges of these incredibly difficult circumstances and create a learning environment for our students, it is important to remember the most important focus for all of us is family, health, and safety. I am confident that we will figure out and get answers to all of our educationally related concerns and questions, and there are many. There is no doubt this will take time. But remember to give yourself and your children the gift of patience. Take care of one another. We're a strong community, and we're going to get through this. But we must continue to do our part to slow the spread of the virus, so stay home and be safe. I'm now going to turn the podium over to Christine Feldman from our wonderful libraries.
Good morning. I'm Christine Feldman from the Arundel County Public Libraries, and thank you to the county executive and his staff for having us. Libraries, like the school system and many of our other public officials, are eager to serve our customers. Our staff miss seeing the faces that they get used to seeing every day at our libraries. But the good news is that the library is open 24/7 online. You simply need to go to our website at aacpl.net, and that will give you access to a world of information, education, and inspiration during these tough times. I want to encourage folks who don't have a library card to please sign up for one. You can get a virtual library card through our website. And if you've lost that lovely little yellow card or forgotten a PIN number, you can easily go to our website and sign up for a new virtual card that will get you immediate access to our tens of thousands of ebooks, e-audiobooks, e-magazines, and even streaming movies with our Canopy service. It's really the best way to use the library while you have some downtime. There are countless educational resources that families can tap into during this time that we've always had, but we've bolstered a bit to help our folks who are trying to serve the needs of students. For our youngest, we're actually offering virtual story times on Facebook Live. Almost every day of the week, you can tune into the library's Facebook page and get a story time from favorites like Mr. Steve or Miss Rebecca. It's really a great way to help your preschooler prepare for kindergarten in the future. We also are offering adult programs via Zoom. We're offering a Friday night classic movie chat with our lovely staff who are eager to serve, and we're doing open mic nights for poetry readings. So visit our website, again, aacpl.net, and check out that complete schedule. To help our families who are trying to work through the educational challenges that many are facing, we're offering a number of educational resources. I want to encourage folks with young kids to go to our special section on our website. It's aacpl.net/kids, and there you're going to find educational and fun games as well as tons of resources. For example, our Tumble books, which are animated talking books, are available for young children, and we just added Tumble Math, which provides lessons and tests in math for kids ages kindergarten through 6th grade. So it's a great way to help your kids stay focused on their schoolwork. For older children, we offer tons of other educational resources. So for our high school seniors and juniors, SAT prep, our online tutoring program that's available for every student from K through community college. It's called Brain Fuse, and it's a free service that the library offers every day of the year from 2 p.m. to midnight. It's free expert tutoring in any subject We'll review college applications, we'll review papers and projects. It's really the best way to get one-on-one virtual help with your college and all of your school needs. We also offer plenty of educational resources for adults. So if you've got some time on your hands, perhaps you want to learn a new language, check us out to learn using Rosetta Stone and Mango languages. For our genealogists, you can take advantage of Ancestry.com, which is now available at home. Used to be just in our branches, but now we've made it available for our customers to use with their library cards. Additionally, we have tons of other learning opportunities for adults. Skills building, you want to learn some computer skills, you want to practice for the civil service test. You can get all of that through our website. We also offer plenty of job search and resume help. It's a really critical service that our staff are happy to offer virtually. They're very much used to offering that in the branches, and this is a way that they can continue to serve the community. So I encourage folks to go to aacpl.net/jobs to find all of those opportunities. But the best and most important thing I want to say is that we miss our customers. We want you to take advantage of all of these countless digital resources, and we're eager to open when it's safe to do so that we can welcome back our folks in our 16 branches around the county. So again, check out aacpl.net for all of your educational, inspirational, and recreational needs. Thank you.
Thank you, Christine. You see, there are so many other choices besides Tiger King, Murder, Mayhem, and Madness. So check out the programming that's on the county library site. Dr. Nilesh, you promised to show us how to make a mask. So
I did, and I'm ready. I'm going to take my mask off so you can actually hear me. This is something you can do at home. It takes about 2 minutes to do. I did it this morning. May not be the prettiest, but I did it. And it should just require things that you already have at home. What I have here is a bandana. It's about 20 inches by 20 inches. If you don't have a bandana, old t-shirt that you cut to size will be perfectly fine. All you need is either A, I have girls in my house, so I have a lot of these hair ties lying around, or rubber bands would be just as good. And then if you have a coffee filter and a pair of scissors to trim them down. So the first thing you do, you fold this in half, like this. You take your coffee filter, any size will really do. All you're doing is just cutting it to open it up, like this. And the reason you're doing that is just adds another layer of filtering. What we're really doing here is just creating a lot of layers so that when you're breathing, each of those layers is filtering your breaths in and out and catching any virus if there is either in you or from the air. You put this in the center here, and then you fold this top part over here, this bottom part over this way. Take your 2 ties, put one over one end, put one on the other end, and you fold these ends over, and then you'll have to adjust this to your ears, but that's it. That's your mask, and then you put it on. Two minutes. You can get nicer versions like the county executives, but this will do in a pinch.
that was amazing. Thank you. Martha Stewart. So let's begin with some health questions. Dr. Nilesh, would you update us on the latest activities and information that you have?
Sure. So we are, as the county executive noted, we are working with all of our healthcare partners, our hospitals, and also our nursing homes, our assisted living facilities, to really make sure that not only do we have the ability to provide hospital level care for those who need it, but also that once people are recovering, whether it's from COVID-19 or not, that they can be discharged from the hospital, whether that's to their house where they're staying, or in a nursing home if that's what they need, an assisted living facility if that's where they need. And we've been working throughout county government to make sure that we have enough hotel rooms available for people who can't get discharged from the hospital for whatever reason, because they either don't have a home, or to go back home with a diagnosis of COVID-19 would put others at jeopardy until they were fully recovered. And so we're preparing, and we put into place a number of things to ensure that people can both get into the hospitals and get out of them as well.
Does anyone have a projection for when there might be a surge in Anne Arundel County?
So this is a hot area of discussion. We have been working with the Maryland Department of Health and others to look at what the projections are. What we're seeing is that over the next 4 to 6 weeks and even more, we're going to be seeing increasing numbers of cases. The surge, as we talked about, it doesn't happen on one day. It happens over a period of time, and so we're expecting to see more and more people get sick, and more people need hospitalizations. We're really looking in the next couple of weeks to see what happens. About 3 weeks ago, we started putting into place, and it's been ramped up incrementally, a lot of the restrictions that we are now living with today. And it takes a few weeks for those actions to be reflected in the number of people who are sick and the number of people who are hospitalized. So the next couple of weeks are really critical for our understanding of which way we're headed.
This is one of our Facebook Live questions. Is there a plan to make masks available to essential workers or the general public?
So a couple of things. One of the things is that the cloth masks that we're talking about are for the general public, and part of the thing that we need to make sure that we do is saving those surgical masks and those N95 masks for healthcare workers, for first responders. Those are the situations where they need it. Also, there are shortages, and so we really want to make sure that we conserve it for them. We have, in addition to being able to make your own, I know that others are working on making these masks. We're working with partners to figure out how we can distribute them as well. But I want to emphasize that you don't need a fancy mask. You don't need a really wonderfully sewed mask. Those are great. Those are more comfortable, no doubt. But the key is to just make sure that you've got layers. And so we've even seen masks that are paper towels stacked on top of each other with staples and rubber bands. May not look pretty, but it's going to work.
These next two questions are closely related, so let's take them together. When will information about county health spots of the virus be available? And is it possible to share county-level stats like hospitalizations, testing numbers, case ages, and county hotspots online with daily updates?
So we're working on providing more data on our website, and we were hoping to be able to get some of that done by the end of the week. So we're really targeting Monday or Tuesday to be able to put that data up online around test numbers, hospitalizations. We are looking to provide some more granular detail around where the cases are in the county. We can't quite figure out right now which way we're going to go, but we will have something up probably by zip codes is where we are thinking, hopefully this Monday. It's really just a matter of being able to make sure that we can accurately represent what's happening. So that is coming.
Okay.
Can I say something about, can people hear me with this thing on?
I can.
I think they can. I think they're going to have to, right? Get used to that. I just want to commend our health officer for his work on getting data and working with the data that is available. We, just like the state government pressures the federal government to do things, we at the county level, I'm sorry, it's falling off. we at the county level have been, the county executives meeting daily, actually by phone, and telling the state what the counties need. And one of those has been this data. And when we did finally get some state data on modeling a few days ago, I was really impressed with the way our health officer has put together already a plan with the hospitals to start monitoring the actual performance with the data to see whether those trends are changing and to see so that we're prepared. And just in general, I was asked at a town hall last night at Fort Meade about our contact with the state and the feds, and I just want to say that it's been really constructive, that we have a weekly call with the governor on it. We have additional calls with his staff, and we've had calls as well with our congressional delegation about the CARES Act and the funding that's going to be available. So we're peppering them with questions, pushing all the time for more PPE and everything that they can provide. But at the same time, our central services folks and our emergency operations folks here are not resting. We are scouring the country and the world for all of the supplies that we can get.
That dovetails into the last question I was going to ask in this area. Are Anne Arundel County hospitals currently able to take care of those hospitalized with COVID symptoms?
Yes.
For example, are there enough respirators and ventilators?
So they are. Our hospitals are currently able to take care of that. They have not only plans, they're executing the plans to be able to handle an increase in volume, both for those who are hospitalized and for those who need intensive care services, including the ventilators. We are working closely with the state to get more ventilators into the state. Obviously, that's a need everywhere, but it's really been an effort to rethink how things are being done. In addition to the ventilators the hospitals have, they also have anesthesia machines, which they're reprogramming to be able to function as ventilators, and they will work just as well as the ventilators they bought to be able to do that. We're working at the state level to be able to reallocate ventilators from those areas which might have more than they need currently to those areas that have less than they need. And that system is supposed to be coming online shortly, meaning within days. And the state has also purchased additional ventilators, which are going to be delivered later this month, that will then be distributed to the hospitals. So that planning is not only underway, but is being executed as we speak.
Thank you. So let's move on to our schools, our kids. Dr. Arlotto, what can be done to ensure that school-age kids have internet access for online learning? Is there anything the community can do to help?
Yeah, that's a great question, and it's not new to us. We have explored possibilities for a number of years, and we just simply have some areas in our county, and it's true across counties across the state and the country, that just have spots that don't have service or have reliable internet service. So it is a concern for us. First, as I said, we're distributing devices so that students have those, so that they can at least go to places that do have a Wi-Fi signal, where they can access some of the learning online, or all of the learning online, when they can get a signal. For those in their homes, as I stated in my opening remarks, I know that Comcast is offering their Internet Essentials program, access to the internet for free for 60 days, and they have also opened up Wi-Fi hotspots. So we're encouraging families to get out and try and use those, take advantage of those as best they can.
Thank you. This next question came via Facebook Live. Will the work students do online be graded?
So the answer is yes. We'll be asking each of the teachers. They'll be in contact with their students at the various levels, but we'll ask that there'll be a graded assignment or assessment each week while we are in this closure period. So there will be graded assignments or assessments that the students will complete and turn in via online or in hard copy form, and we're still working that process out for students that don't have access to the internet or a device immediately, but there will be some graded work, yes.
Thank you. There really is no way to do justice to this next question except for reading it word for word. It's rather lengthy. It's Dear Mr. Pittman, Dr. Orlado, I'm writing you as a plea for assistance with an ongoing issue that is affecting underprivileged students from Annapolis Elementary School. We're having trouble getting a sustainable solution in place for this problem. I'm a parent that is closely in touch with the Backpack Buddies program that is supported by our school volunteers. The week after school was dismissed, for an undetermined length of time, I was notified that students from the Clay Street neighborhood were not able to access the Daley Bates Middle School feeding site that they had been designated. Knowing this population and some of these families well, I can think of many reasons why they were unable to access the food they needed there. We alerted our principal and school counselor to add a mobile curbside feeding drop-off location to this community. This request has been repeatedly denied with no explanation nor substitution. Want to take that part of the question?
Sure, I'd be glad to. Yeah, that's, I'm not sure about the no explanation. We have been working on this issue for several weeks now. We have worked with, so this is not, it's not an unknown issue to us. We want to try and reach, we want our meals to reach as many students as possible. But as I said in my opening remarks, we are limited by staff and logistics where we simply can't provide meals in all the neighborhoods, even all the neighborhoods that have the greatest need. We are at 60 sites now. We'll continue to make adjustments as best we can to provide meals. That said, we have worked on this very particular issue for several weeks. We've worked with staff from Delegate Henson's office, staff from Senator Elfreth's office, and staff from the mayor of the city of Annapolis's office to try and come up with some solutions. One solution that was brought up and has been implemented is, I know that the city is running a bus that picks up at Washington Street and is picking up children, taking them to Bates and doing sort of a loop. Not a lot of students have taken advantage of that. We hope more will, and that bus can make several different runs, but Bates is about a mile away. It is a close site, and we are able to produce a lot of meals there, and so we think that's a good place for students to take advantage of. But if there are other solutions, we are certainly willing to work with the community. I know that Dr. Pam Brown, with the Partnership for Children, Youth, and Families, is working on this issue as well. So there are a number of different community partners that are coming together to hopefully bring some resolution. But in the meantime, we'll ask the students to get on the bus that the city of Annapolis has provided and take advantage of the meals, 3 meals a day, 5 days a week at Bates Middle School.
Great, thank you. Please address the high school graduation. Will seniors still be able to graduate? Will the ceremony be delayed or canceled?
So let me separate graduation and earning a diploma from commencement. We are focusing on our seniors. We want to make sure that our seniors earn the credits they need so that they can graduate. And so that's a key area for us. It has been since since our closure began. So counselors will be in touch with seniors, certainly teachers, over the next several weeks to make sure that most of our seniors, if not all, are on track to graduate. One of the things that will play in that there are state standards for graduation, particularly in the areas of career and technology education, that we'll be working with our partners at the Maryland State Department of Education and requesting waivers. So for this class of 2020, in some very particular areas, again, career and technology education, those students that are at CAT centers, it will be difficult to get all of their work-study hours certainly in the circumstances that we're in, or in the remote modality that we're in. So we will be working with the state on some waivers, but we are working towards getting all of our seniors to move towards graduation. Commencement is the second part of the question. Commencement's different. Commencement is walking across the stage. There is no state law around commencement, but we know how important it is. So as of right now, I have not canceled any of the commencement exercises. They are scheduled to begin in the first week of June. Right now, they've not been canceled, but if we were to have to make a decision today, we would have to cancel them because we have venues, the venues that our graduation will take place are closed, and we can't bring more than 10 people together in an environment. So if we had to make that decision today, they would be canceled. We are not making that decision like proms. We are not making those decisions now, and we'll make those decisions in the future.
Thank you. This next question comes from one of our teachers who wants to know, will teachers be able to gain access to the buildings for a few minutes to gather their belongings?
So as of now, the answer is no. That is a state mandate from Dr. Karen Salmon, our state superintendent of schools. The other, my 23 colleagues, the 24 of us, the other superintendents around the state, as I said in my opening remarks, are working very collaboratively and closely together. We have a list of many questions that we need answered so that we can move forward with our communities and our learning across our school systems, implementing learning across our school systems, and this is one of the questions. We would like teachers to be able to get into the buildings, students as well, to retrieve personal belongings, and even many teachers would like to gather some of their instructional materials to aid them in developing and delivering online instruction to students. As of right now, the buildings are closed only to our building service staff that are doing cleaning, our food nutrition staff at those sites that are preparing meals in kitchens, and on an emergency basis for students. We've had about 12 so far in the 3-week closure that have needed to access medication in our health suites, like medicines and EpiPens, and we've been able to grant them, we've gotten access into the buildings to get them those in an emergency situation. But as of right now, no, teachers are not going to have access to the buildings until we've been given clearance from the state superintendent of schools, but it is something that I will continue to inquire about in my 3 times weekly meetings with the state superintendent.
Thank you. With just under 5 minutes left to go, one more school question, and then let's move to some general questions. Are the schools considering recovering missing days in the summer?
Yeah, so it's something that we are thinking about, but it is not a decision one that's been made yet, and it will depend greatly on what our state superintendent and the State Board of Education make some decisions on, because that would require a waiver of our current regulations that we are guided by in education in the state of Maryland. Our students are required to be in school a minimum of 180 days. We know that we were out for 10 already. Where there was no instruction, teachers were not working, our 10-month staffs were not working, and our students were not fully engaged in learning to that first 10 days. They have begun that process now this past week. So we'll have to wait we'll be requesting a waiver from the state superintendent to waive those initial 10 days. If they are not in some way, shape, or form, then we may very well have to extend the school year to make sure we meet that 180-day requirement.
Thank you. Given the possible long-term impacts of the pandemic on the transportation and distribution of the nation's food supply in the coming months, has your administration, county executive, considered asking county farmers to increase their production of fruits and vegetables for sale at local farmers markets later this year?
No, we have not asked them to do that. The farmers markets are open, and farming is an essential business. And I know that farmers are not slowing down in their production of food. We've not specifically asked them to do more. I have not heard that there's going to be a shortage of food, that the transportation system is working, food is being delivered, grocery stores, while things that people are hoarding may not be available, that all the other food so far is continuing, and I haven't heard that that's going to change. But I would always encourage people to get fresh fruits and vegetables from our local farms. And on the hoarding issue, I just want to discourage people from hoarding coffee filters now that we know that they can be used in our masks. Just buy what you need, please. We can't go without our coffee.
Thank you. In closing, I wonder if each person on our panel today would talk about mental health resources and provide some advice for everyone to weather the storm in the most healthy way. Dr. Nilesh?
Sure. I routinely end my conversations by reminding you to be kind to yourself and to others. It's been a lot of change in a very short amount of time. We're not even at a month when we had our first case in Maryland, and as much change as we've been through, it can be hard to sustain it. And I want to echo something that the county executive said to begin with, is just noticing the kindness and the consideration that people are giving each other during this time has been one of the things that I think I will take from this the most, and to continue to do that, I think is key to that. It's easy to beat yourself up about what more you could do or what's happening, but taking that moment to be kind to yourself, I think is probably the biggest thing that you can do for yourself during this time.
Thank you.
Well, in terms of actually getting resources, the mental health demands in the county have been increasing before this. Our mental health agency has been overwhelmed. I think it's a 30% increase in requests for mental health services in just the last couple of years. Our crisis response teams are still working, but they obviously can't serve everybody that needs it. I know that telehealth and telecounseling are on the rise during this, and that the federal government has even waived some requirements for reimbursement for that. And there are lots of health professionals that are offering that service now. But I think that, given the scope of what people are going to need, that to a large degree people are going to have to work with each other and do mental health the good old-fashioned way, which is to stay healthy, to get exercise, to be kind to yourself, which I love that concept, and ask for help from your friends and your neighbors and your family when you need it.
And I would agree with my colleagues. With regard to the schools, our counselors, our school psychologists, our pupil personnel workers, and our social workers are all available. They will be reaching out to students. If there is a need, please let your child's teacher know, or assistant principal or principal, and they'll make sure that counselors, psychologists, social workers, and pupil personnel workers are reaching out and providing services as best they can. Certainly, we've got an amazing team in Anne Arundel County in the trauma response, but our folks in the school system are available as well. And certainly, in closing, in agreement with my colleagues, giving yourself the gift of grace and patience. You do need to take care of yourself. You need to take care of your family. You need to take care of your health and safety. That's the most important. And we're going to take this one day at a time. So giving yourself the gift of grace and patience, I think, will go a long way.
Thank you, everyone, and thank you for participating. That's our final thought. We're closing out now. Thank you.